Making the Invisible Visible, Black Women 365 Days of the Year. Each day will spotlight a remarkable woman whose story has shaped Black, British or global diasporic history. Women whose achievements are too often overlooked. Through these daily short films, we create a living, breathing archive of leadership, creativity, resistance and legacy. Let's begin.
I'm Elizabeth Anionwu, Elizabeth Nneka Anionwu. I'm of mixed race. My late parents were Irish heritage mother, and Nigerian father. I didn't find my father until I was 25, but I knew him then for 8 good years until he died quite young. My mother had always made sure she was never going to give me up for adoption or anything. She was in her second year of studies at Cambridge University when she met my dad. They never stayed together. And I'm now I'll be 79 this year. So I've grown up, born and brought up in this country, but very conscious and very at ease and proud of my dual heritage. I think that explains who I think I am. How society views me, of course, is something quite different, but let's leave that.
Okay.
I am retired now, but I'm very fortunate in the fact that having been the very first sickle cell nurse in this country way back in 1979 for 10 years and currently still a patron of the Sickle Cell Society, it's still one of the areas that I have a great deal of commitment to. But anytime the charity wishes to ask for my support, I'm very keen to do that. On the other hand, I'm a mother and a grandmother. And so it's great in real retirement to be able to be much more involved with them when I was a single parent working. So I think those are the two areas that, if you like, define me still today. So from my background of nursing and health visiting, I first came across a family with a young lad affected by sickle cell disease. And whilst the mother was quite happy with the hospital care, she felt really helpless and lacking in support in terms of how she can care for her son better and try and keep him out of hospital so much. And I felt so helpless when she asked me for specific advice about this illness. I'd never been taught about it in my nursing or health visiting courses in London in the late 60s and early 70s. I was so angry that is what spurred me into seeing how can I educate myself so that I can be of more support to others. And it was going to the United States that really enabled this for me. Just on holiday, but visiting sickle cell centers out there, and that is what has driven me, together with the family's experiences and my work as I said, the first sickle cell nurse counsellor in the UK. Do you know that? It's my great sense of humour, because it's carried me through such challenging situations. I mean, I may not have laughed at certain people that needed laughing at. That would be very unprofessional, wouldn't it? But to be able to go home and put on a really good comedy program on the television, or I don't know, it has helped me to deal with my frustrations. But it's also enabled me to share laughter with like-minded people and lift my spirits enormously. the most important thing that I share with groups when I'm invited to do so is love yourself, like yourself. And even though society may disrespect you, may look down upon you, if you remember that you are somebody that you like, and also store up in your brain why other people like you, so you can dip into all of that when life gets really tough.
Thank you for joining us for today's story. Making the Invisible Visible is our commitment to ensuring that Black women's histories and contributions are recognised, valued and kept in daily circulation. Across 2026, we will continue to share these powerful narratives, 365 days of impact, brilliance and inspiration. Stay connected, join the conversation and help us champion the women whose journeys continue to shape our world. I'm Paulette Brooks and I'm looking forward to seeing you tomorrow for the next story.